Hello and welcome. You're watching UATV News with me, Ksenia Buhai. First, this hour, the latest developments from Ukraine. The infrastructure for receiving, delivering and storing vaccines is ready in Ukraine. The Ministry of Health has already prepared a plan to modernize the equipment for the cold chain.
There
is an mRNA vaccine that requires a storage temperature of -80 degrees. Other vaccines currently in use and approved for use require from 2 degrees to +8 degrees. We have storage facilities for both the first and the second vaccines. When we talk about a vaccine with a storage temperature of +2 to +8, our state-owned company Ukrovaktsina and the Ministry of Health have the capacity to store about 30 million doses of the vaccine.
Meanwhile, over the past day, the number of people who have recovered from COVID-19 twice exceeded the number of those who fell ill. More than 8,000 Ukrainians overcame the disease, while more than 4,000 were infected with coronavirus. Most of all new cases were fixed in Ivano-Frankivsk, Lviv, Zaporizhia, Dnipropetrovsk regions and in the capital. Several countries of the European Union are ready to resell surplus vaccine against coronavirus to Ukraine. Since the EU has purchased 2.5 billion doses, which twice exceeds the amount necessary to vaccinate the entire EU population, Ukraine's Vice Prime Minister for European and Euro-Atlantic integration said that the government is completing negotiations with the EU on redistribution of COVID-19 vaccines. I would also like to thank the EU member states which, not having such a surplus, promoted the interests of Ukraine and the need to ensure the country's access to vaccines. This is a great sign of solidarity. I'm sure that this joint work has given results. Today, the Health Minister informed that Ukraine has received confirmation of the supply of 12 million doses of AstraZeneca and Novavax vaccines. The first batches are expected to arrive already in February. I am and I will be. This is the slogan for World Cancer Day this year. For 21 years, at the beginning of February, people all over the world drew attention to the fight against cancer. In Ukraine, more than 1 million patients are registered in cancer centers, and every year, 14,000 Ukrainians face this diagnosis for the first time. Cancer control is a priority for the Ministry of Health. Our correspondents found out how Ukrainian medicine is fighting this terrible disease.
The slides show the results of Tatiana Kovalenko's lung cancer biopsy. In 2019, she went to a resort. There, she fell ill with bronchitis. Returning home, she went to the doctor in order to rule out pneumonia.
Fluorography showed a stain on the lung, and from that time, examinations began. The last one was a biopsy, which confirmed the diagnosis, adenocarcinoma of the left lung. Then I flew to Israel, gathering all documents. Discs, I flew to Israel for an operation.
The operation was successful, and the woman is sure that early diagnosis saved her life. Therefore, she presented a photo with a picture of her tumor for everyone to see. The exhibition was named Terrible Beauty. The woman is sure that it is not scary to talk about the problem, it is scary to keep silence about it. Every hour, 16 Ukrainians are diagnosed with cancer. The increase of the state funding for the fight against this disease and the purchase of medicines are projects that the Ministry of Health has successfully implemented. For the first time this year, the ministry purchased a patented drug for the treatment of kidney cancer. Those patients were doomed to the financial toxicity of the treatment, since the treatment is usually lifelong and very expensive. They've already added 9 molecules in 2021 for the treatment of adults and 6 molecules for the treatment of pediatric oncology. The main problem for Ukraine is the issue of early diagnosis of cancer diseases. According to doctors, out of 14,000 annual revealed cases of cancer, a third part is diagnosed too late. Because of this, mortality from cancer in Ukraine is higher than in Europe. Therefore, this year, the program of medical guarantees for the early detection and treatment has received more than $179 million.
Із квітня 2021
Since April of 2021, these services will also be provided under separate packages for the diagnosis and treatment of oncohematological diseases, and prices will be significantly increased. For example, tariffs for the diagnosis and chemotherapeutic treatment of cancer will be divided into treatment for adults and children. It will cost $900 for adults and nearly $3,100 for children. As for oncohematological diseases, the prices are $1,600 and $5,860 respectively.
In 2021, the National Health Service signed contracts in the sphere of oncology with 118 medical institutions. The state is ready to fully or partially pay for the diagnosis and treatment of cancer in those clinics. Moreover, the Ministry of Health has developed a cancer control strategy until 2030.
Ми розуміємо, що захворюваність
We understand that cancer morbidity and mortality can be reduced through a nationwide systemic approach to prevention, early detection, and affordable diagnosis and treatment. It is for the implementation of such approaches that the draft national strategy for the control of cancer until 2030 has been developed.
The document includes a list of measures aimed at cancer treatment in Ukraine. It has already been signed by Health Minister Maxim Stepanov. The strategy plan was presented for public discussion at the 3rd All-Ukrainian Forum of Cancer Patients. Reported by Vadim Kramer, Valery Bakus and Inessa Zanina, UATV News.
More than 30,000 Ukrainian kids are receiving inclusive education, Presidential Commissioner for Children's Rights says. In the meantime, according to him, the number of boarding school students is gradually decreasing. Mykola Kuleba states this is a result of deinstitutionalization reform. Its aim is to reduce the amount of boarding schools and broaden inclusiveness in general educational institutions. The 10-year reform foresees the free access to inclusive education in all territorial communities of Ukraine.
Ще за радянських часів.
Yet in Soviet times, a system of a child's isolation in a specialized facility was formed. As a rule, it was a kind of a boarding school in a distant suburb of a small town or village. We all know at that time when a child was different, he or she was not desirable in a regular kindergarten or school. This child was deprived of an opportunity to live and develop in the society, having access to all the benefits regular kids had. This concerned adults with disabilities as well. That's why the Soviet Union was developing the boarding school system.
Creativity Without Borders in Odessa, a couple with disabilities, had a video blog in which they motivate others to overcome life's difficulties. Despite muscle atrophy, Anna Litvinova became a well-known artist, while her husband Maxim is engaged in video editing. Our correspondents got acquainted with the talented couple.
Father puts 27-year-old Anna on the bed. Because of the muscle atrophy, the girl cannot walk. It is difficult for her even to hold a brush in her hands. But the young lady came up with her own way of drawing.
Я рисую в основном лежа.
I mostly paint lying in bed. I'm not afraid of large canvas formats. Therefore, it is difficult for me to reach the opposite side of the canvas with my weak hands. So I came up with a very elegant method. I see the picture even upside down. That is, they turn it over to me from side to side. I look at it and see.
6 years ago, the painter met her future husband Maxim on the internet. He has the same diagnosis. She is very beautiful, very talented and smart. She has many positive qualities. It was simply impossible not to fall in love with such a girl. Anna and Maxim have a motivational blog on the internet. They tell and show people with disabilities how to overcome difficulties.
Мы считаем, что
We believe that every person has difficulties regardless of their physical and emotional condition, and therefore we want to show people that they can go through them.
Anna's parents help the young couple. They are proud of their daughter activities. I am surely proud of my daughter's success. Soon Anna will have another exhibition of her paintings. The young lady will devote her work to the beauty of an imperfect body. Meanwhile, her husband is preparing a new video for their blog. Reported by Vadim Kramer and Anna Horodentseva, UATV News.
Emotion detector in a smartphone. Vinnytsia inventors have developed a software to recognize emotions. With the help of a camera and microphone, the application reads facial expressions and tone of voice, thus measuring the level of a person's satisfaction. The program was developed by graduates of Vinnytsia Technical University to improve the level of service provision in the administrative services centers. As soon as the application is tested, it will be launched immediately. We cannot see the face, but we can hear the voice tone. It is positive or, on the contrary, very negative. It forms such a scale. Now it's green. Its color means the level of satisfaction. The percentage is also calculated, and the service is also rated.
This is a possibility of evaluating reactions and emotions of administrative services centers' customers. It means that the current tools, namely those that rate the work buttons to know whether you liked the service or not, are switched to a modern digital format.
That's all for now. Thank you for watching. Stay tuned. More updates on our official website, YouTube, and Facebook pages.